project and work contributed by many other countries. This is to reinforce the modal improvement strategy launched by the World Organization, which I know have used for quality and safety in your organizations. I hope will provide of the importance of a proven improvement strategy, to have the information to share with others in training packages. And the next slide, for the first presentation, I on WHO's modal improvement strategy can solve, and one important evidence that we have about success. To talk 300 pages of guidelines on hygiene in healthcare, published in 2009. Many will be aware of the static review undertaken to label evidence which lines. There are methods information when they are challenged on the importance of hand hygiene. These guidelines is a great asset to all of us. Go through each recommendation. That is easy for people to do. What's important is the evidence today. Published in 2013 by safety experts, as you can see from this paper on the screen. Top patient safety strategies adopted in healthcare now. This presents power information for us. The challenges that people bring to us about hygiene work. Is it important? Barriers, behavioural aspects that present when adopt this action in their busy healthcare lives. Based on the evidence available, which of course will be welcome, experts have reinforced that hygiene is a patient safety strategy. Out of things that they could have included in this paper, and there are other topics, that hand hygiene is accepted as that important. It applies to countries all over the world in work that has been done. So, as part of the presentation about the principles of a multimodal improvement strategy, and strategy is one improvement strategy. There are many three principles, as you know, from the organisations. But what with the strategy is an of improvement that we all adopt in daily work and in our lives all the time. These are clear and very much add up to a package of activities that will achieve success. And again, evidence for this. The screen, as I wrap up, the first component of an improvement strategy must system the environments in which we work. They must to be able to do things easily to patients. That includes the products available to us, which we will discuss. The second, which I'm sure none of you will dispute, education, one component of ensuring improvement. improvement, reinforcing knowledge, understanding of healthcare professionals, which effect that will lead to success. Monitoring, evaluation and feedback. Absolutely the cornerstone of infection prevention for decades, publications, including work by Halley around sentinel surveillance. Feedback will drive behaviours that are part of an improvement strategy. Component reminds in the workplace, social absolutely vital and very powerful in today's world with all the resources we have at our disposal. But again, part of the strategy. Well, the last part is an safety climate. What are we all working in to that these components can be adopted and applied in every practice? We'll look at each component, but first, I want those of you who have not seen this, or as a reminder for your colleagues, the publication 13 which stated that multimodal strategy applies in a range of countries. The World Health Organization in 2006, with colleagues in many hospitals, would apply that strategy that I've just described and make in different settings. In publication, Costa Rica, Italy, Mali, Pakistan, Arabia. Well, it has been applied and tested in other countries. Publication that I urge you to continue to refer to. Some it covered the opportunities fed back from all hospitals involved in the study. The 423 sessions pre-inception of the strategy, after the engine was applied, and they did this against compliant hygiene, which here, as you can see, knowledge which will improved across that one component of modal strategy being implemented. And action also supported ongoing hand hygiene improvement strategy and scale up. And to note that implementation was significant and did have an effect even after adjusting for main confounders of other things that could have influenced behaviours and actions towards hygiene action. To explain some more of the content of that paper, you hear the different healthcare professions and their hygiene compliance for implementation of the improvement strategy. In all but one of the groups, there was a statistically significant increase in compliance. Also, the 5 moments for hand hygiene. That recommendation that underpins all WHO strategy around patient safety and quality of care. And again, before the intervention, the movement in all of the 5 moments for hand hygiene significantly. There's a whole suite of tools from WHO, based principles that were developed and tested in Switzerland and Geneva, and then up and, as I've described, tested across the world to be sure that such a strategy could apply to different countries. WHO includes the 5 components that I have described. The 5 pins all of this for patient safety and this approach to implement this in healthcare settings. And principles of the strategy and how it relates to patient safety. The whole strategy applied by care workers always has the patient as the focus. And this is whether cared for in a bed or a day or having renal dialysis, whichever setting, in their zone with their area of care and of moments for action that will protect that patient and workers and others. Slide down into the 5 moments for hand hygiene. And this is talked about is easy to do the right thing. The 5 moments allows the flow of busy clinicians to be entered in a way that means they can perform hand hygiene, patient care, where the patient needs to be protected the most. Allowing facilities and alcohol hand job point of care makes it easy to practice and monitor actions of her workers against 5 moments. So this means the environment is absolutely critical, or health will not be able to hygiene recommendations within their busy workflow on a day-to-day basis. The core of training and education done through all training sessions. Ensure all of our training is not other aspects of infection prevention, care, at these 5 moments and highlighting where it's most important with the workflow of clinicians to apply 1 or more of the moments depending on what they are doing. So the understanding of hand hygiene about doing the right thing for patients. Hand hygiene conduct other times, duties for the staff themselves for food hygiene, but we've taught patient safety. Moments run through all training sessions is critical. Include example, training session of intravenous lines, the mixed approach when teach doctors, nurses, laboratories, others to take blood. We ensure we have an embedded approach to hand hygiene education. Monitoring is the goal of most countries around the world. The gold observation is WHO still, while other methods are being addressed and researched. But we're trying again 5 moments. Under exactly when those should occur and whether for applying those moments in their practice. Times for hand hygiene. Maybe other reasons, but will support the patient safety improvement that we are striving for. Reminders are vital. Many posters and screensavers and many things are developed. We need to ensure the 5 moments runs through all of these. Messages must be consistent, must be over and over if we are to change behaviour. Vital that patient zone, those critical times for hand hygiene, are reflected in all our marketing reminders. the culture of our organisations is challenging. Leaders are absolutely vital. There's many countries now that we manage through the WHO programme, but it's fair that the leadership is vital to all of this, and without it, the other components of the strategy will not be able to stay alive and be sustained. To have people understand what that safety climate is like, how it feels, there are tools available to measure the current organisation, and they do leadership and role modelling, and it's something again we must continue to strive to. 5 components of a multimodal strategy intended, depending on your local environment and your progress, which aspect you would focus on most at any given time. We consider range strategies available to us. And what I sent to you on this next slide is Warren Mitchell, a change expert from the United Kingdom, how we can influence the change, engines and long-term behaviours of our colleagues through quality, opportunity, action, and psychology, essential if we are to ensure the environment and patient safety. And look at W improvement strategy, it simplifies from the previous slide into teach education part. It provides capability to drive behaviour. Down into building it, the system change, checking it, the monitoring, which offers opportunity to drive behaviour to do the right thing. Can be driven by selling it through others and through that organisational safety climate. Let the actual things that we want to happen, being and ensuring that the 5 moments that safety is always our focus. W have developed, as many of you know, over 40 tools to allow us to implement this strategy. Some can be difficult to know start. We actually decided that it would be useful to help people assess just as they stand in the ongoing improvement of hand hygiene action to protect patients. I present to you, as many of you know, the hand hygiene self-assessment framework. Briefly, on the powerfulness of this strategy, this framework, on their journey for improvement or to help them reach an advanced stage of improvement. To help focus again on improvement strategy and which components we should dedicate time and resources to want to achieve success. And to our colleagues in Spain who have very much supported the development of many of our tools, this tool exists translated into many languages found on WHO web pages. This slide examples of those available, but there are many more. This framework, as well as the improvement strategy being tested, this framework was tested in different countries, as you can see, map of the world. And again, present this information to people that can work for them. Many will say our setting is different, our organisation is different. So aim to help people use tools in their settings without having to develop themselves and to understand that they can actually work. When work, it's a traditional level tool, which takes on average 1 to 2 hours to complete. Just to understand exactly where practices with hygiene improvement. Many are doing work completion on a monthly basis in order to monitor their progress and see what next steps they can take. Like structure, indicators with score, all of which were worked out with a group of global experts and tested, as explained, and based on how improvement can be achieved and detail in the guidelines. The score given is the things that we know best make it easy for people to form hand hygiene as a routine habit people progress through to advanced stage of implementing the improvement strategy. Before that, it actually gives us to the many tools available from WHO and those that exist in healthcare settings. It guides that will help us take the next steps to achieve a greater score. As you can see, it's just one section where you score, but there are a number of other indicators for system change, that first part of the improvement strategy, that are vital, including availability of alcohol hand rub in a consistent supply at point of care. And directions are given to help you complete this framework. The second feature, training and education. And others, taking the evidence that are going to continue to improve. Evaluate back, again, score for each of the strategies independently, adding up your score, looking at things against WHO recommendations, including the workplace and safety climate, and role modelling existing in your organisation. Once completed, and this can be done through analysis, through having channels or link personnel in different settings, sample of wards, talk your procurement services, so that products are available, talking this information, much of this information available already, but you must validate and be sure that you use the framework to the best of your ability, because it's powerful in helping you change the system to your healthcare organisation and advance hand hygiene. The scores for each section and its results will present to administrators your progress. To have much more work to do is powerful in dedicating resources. Have progressed, intermediate or advanced, mean set success, and to continue to have this dedicated. All of these components help you to achieve the safety that you strive for. As our levels of results, and the majority of healthcare organisations around the globe are intimate, intermediate, or advanced. It's important you strive towards leadership, as you said, components that should only be addressed if you've advanced level. And that's being shared around the globe with WHO and learn from people's success settings in order to know what could work in ours. To the tools that are available to help you progress to leadership to advanced level. The right here, I've mentioned. This is official. 5th of May. I can see a reference to hand washing. and where alcohol hand rub is available readily. And this concern, given the WHO recommendations, is of course acceptable and indeed recommended at times. We know in order to address human factors and workflow, businesses will not to wash their hands outside where they, for example, to line and a moment to for hand hygiene is essential. Alcohol's current recommendation allows us to make it easy to keep safe and do the right thing. Hygiene must be the phrase around the world that we promote in order for people to understand the value of both hand rub and washing. Tools that exist from WHO are many, and as you complete your self-assessment framework or you need others to do so, we can encourage to use a number of tools to assess to hand rub, to water, to refurbishing, to have sinks in the right place. You should tools, especially when staff are hand rub, do not feel it suits their skin, their environment. Look at assessing these from staff to make sure tolerability and acceptability can be addressed scientifically, can be used properly, to still be used at the right times in the right way. Training tools exist in many countries. Again, to be sure that training is clear and effective. That it is at least annual as recommended by WHO, while many are training much more frequently because it can be done in so many ways, not taking healthcare workers, but healthcare workers, clinical practice, but doing it with them as part of their workflow and helping them understand again where the 5 moments for hygiene will fit within their work. There'll be a number of slides around ground reasons for hygiene is essential and application of moments for hand hygiene. This is really useful for people to see just where the moments fit and him to understand by challenging why hand hygiene happen at certain times. Of knowledge and background information will change behaviour to a degree, provided if people understand how it fits with their schedule. I've mentioned observation, and the WHO has set, which is observation of hygiene practices, but also of structure, of perception, and of knowledge. You will understand the factors they're dealing with, be able to bring full results, and them can improve and make it easier for them to understand hygiene. It is everything, and we can move without it. But it meaningfully actions that allow healthcare workers to see ideas for improvement. Again, patient tools, always amending the self-assessment framework to help progress. Tools are available, as well as questionnaires. And developing your own, we check these evidence-based tools that have been tested in order you can include detail within your own tools. There are many for managers, for and are some of the other tools which don't act as tools to assess the situation, but act as tools for training. place prompt and do reminders, but must care workers in that setting. It can be very, but we know that marketing tools actually do not have an impact. So those and remember, component of a multimodal strategy is essential. W many tools for you, remind in the workplace with just some of these features. Check the WHO web pages this week for all the resources that are developed for May 2015 as part of Hygiene Global Campaign. Use these. The response and feedback from countries and hospitals has been even more than ever. Many of you have translated these tools and resources already. It's not just to use these around 5th May, but all year round. There's an abuse screensaver which highlights the 5 moments and it can prevent the spread of antimicrobial resistant germs. This is and is a very powerful tool again to be used to remind people that hand hygiene is important. A reminder about the tools available from WHO. You can sample here of a London hospital leadership campaign to remind people the importance of hand hygiene. And many available from WHO. We urge you to use these as part of the strategy. All aspects shared on an ongoing basis. And it's the point of care to the patient where hygiene is most vital. And why point of care is essential is on work that the risk of microbial transmission and the human factor elements that exist that will influence behaviour and help people to be about the needs of patients and washing hands moments when touching them is so vital. The depth of care is clear. 3 elements come together. Patient, worker, and side of care or treatment. Hygiene was first called before patient contact. Testing and considering the importance of marketing within this, the importance of language. Certainly, it was told that that phrase was changed to before touch a patient. When reading your definition, when in colleagues to know why these 5 moments are so vital, we emphasise it is at the touch, the context. The word often is used just when people are talking to each other. And when doctors at patients just to talk in the patient zone at that point of care, but just a conversation. That moment before touching a patient, mushrooms all that we have moments for hand hygiene within workflow are touch. That is how the bacteria are spread. Not insist on inappropriate or redundant times for hygiene. When that turns people off to this action that could save life, understanding of just how important it is and how germ transmission happens. So we must focus on those words and on these definitions. The purpose against the 5 moments, again, vital, because the of compliance during daily work routine, muscle healthcare workers and muscle to them when it's fed back in order to plan your promotion that will help the times when they're failing hand hygiene, operation not just to give the same nutrition each time, but to your health workers, ensure that management Admits have their feedback so that they will commit resources to ensure that culture is healthcare to its 5 moments for hand hygiene. I think hospitals all UK and in Europe see management and administrators be willing to be trained on what moments for hand hygiene means. If they do not understand what it means, they will appropriately support healthcare workers to improve. For observations, as I'm sure you're aware, which provides a compliance rate all on the 5 moments. Before touching, an example just not moving. Examples of before touching a patient. Phrases you may create your own, and important if we're sure that people really understand what this means, and we need them to do it frequently at the times when it matters. Moment for touching a patient, and then want to be sure we don't spread to other patients and reduce the burden of microorganisms within general environment. Examples are given here. Wordly and have available to help people understand. Moment 5, a challenge moment and about reducing the burden of microorganisms in the environment and understanding that patient zone. That the patient is it at that time, or the zone is not patient but moves their equipment, checks an alarm. That is like touching the patient. They will be falling around that patient zone that is defined by WHO. We do not spread these germs around to others. However, and on to this year's WHO 5th May call to action, the role of hygiene in preventing the spread of resistant organisms. Critical sites, as WHO defines them, sites risk to the patient, a risk of colonisation through touch, and breaching the body systems directly result in threatening infections. And this is the last chance to protect a patient from a harmful microorganism that could cause harm, death, and serious ongoing repercussions. Can be defined easily around blood samples, suctioning, examinations, anything that breaches that skin integrity where or greater chance to take hold and cause infection. And think 3, and resistant organisms that are presenting themselves in our environment today, protecting the patient from next touch with you, but protecting yourself and others through ones that may be existing within blood or the fluids. So more frequently follows a mode 2. Mode follows that procedure, that invasive procedure that has been taken, and essential immediately before moment 2, a clean procedure, and after moment 3, that body fluid exposure risk, whether worn or not. Huge distraction. And the WHO emphasises these moments apply whether goods are worn or not. Implementing this improved strategy, which is tried and tested And we'll with you, it's similar to other improvement strategies. It makes sense. It's something we actually do. It's something that we know will help us improve many things, not just hygiene. This approach to applying all the components based of your self-assessment framework is all in your planning. The step of the course of a year must be ready to accept an improvement strategy. Other efforts will be in evaluation. We know that is vital and can be powerful. If a baseline, people will the improvement approach that has been taken. The mutation phase, all dedicated to take enough time to implement and not distracted and not it isn't working and too soon. It's common failure for improvement strategies. Dedicate time for follow-up evaluation so that you could baseline and then actually able to action plan across the facility and continue with success, and this has been demonstrated. Which is not on the slide, and visit the WHO web pages, because on the 5th of May, this Monday, the stories of improvement from one country, Costa Rica, as a main page improvement story. It has enhanced the lives of patients. Hospital in Costa Rica, where the improvement strategy was first implemented, but has been spread across the country, the region. The story is powerful to help us all know how important it is to use strategy to a stepwise approach to it over time. This can reduce health-associated infection. Its abilities to consider 300-page guidelines, measures, a step approach, test obviously today and ongoing basis will show up to achieve. I come back on how vital it is. It's 1 to 2 hours to visit a whole facility and to understand what you use, what you think to improve hand hygiene. And last, we do hand hygiene. In many advanced facilities, hygiene for many years, to be honest and accept that where hand hygiene of the 5 moments at the compliance rates are still very, very low at 30%. A lot achieved, but I don't think it has been sustained, and we focus on how to do that. Self will help this. The imaging, as I said earlier, everything that we do, seeing it as a standalone burden to the many activities that we ask workers to do. It's 5 moments that within care bundles and help clinicians understand the importance of this. We'll take the next stage of hand hygiene improvement. Use the plans, be sure to action plan. There are examples from the show. The hand hygiene is an intervention based guidelines that dictate the outcome of patients. If and is the key word, which I don't believe will be achieved, this harm. Hours of in adherence and implementation of guidance and improvement strategies, it still happens, leading cause of patient death still in here, because in implementation and planning to be sure that people can do the right thing easily is a key quality indicator, and now, without any excuses, without any barriers, this ended. Use that powerful article to convince colleagues. Technology will help us to do that, and WHO tools, along with all that you do in your countries, and that you're across this project and with WHO, ensure that we can protect our patients, like this man who lost his leg through MRSA in England. I'm just minutes, and do not include information about WHO 5th May Save Lives Clean Hands campaign. Some report being issued that hygiene within the importance of patient outcome to antimicrobial resistance. A challenge that is a global concern, and as some are calling it, the antibiotics of new antibiotics available to us, of the antimicrobial resistance that exists in many countries despite efforts to control it, still have to do on the misuse of antibiotics. The mental aspects of infection prevention will be the way of how we protect our patients with antimicrobial resistance. I know 2 new reports have been issued by WHO. One, surveillance of AMR, a document that contains a lot of detail, a lot of data, all of the information available to date that will again the profile of AMR on the countries across the world, and systematic review summary which will have hand hygiene and drug-resistant germs. Medical studies, you will know, while this again gives us the opportunity to prevent just how powerful hand action at point of care, visiting moments 1 and 2 and 3 around protecting the patients and the spreads of drug-resistant germs. It gives us the opportunity to this to our colleagues, highlight the evidence that we have. Hand hygiene, you can see from this new image, WHO protect patients all over the world. There are numerous new posters issued and translated by WHO as a screensaver, new reports, videos, many available to you. Does not just happen on 5th of May, but and then join hand hygiene up with patient outcome, those being affected by resistant organisms. There are references to conclude this presentation, and I have, as well as, of course, the WHO web pages, and for you at what's available to convince our colleagues that human factors and behaviour documents available. In England, published a paper on infection prevention and human factors. A common looking at the evidence that's around behaviour change for infection prevention and prevention colleagues across the world. So behaviour change experts and advance, because we have evidence We have research in the papers, infection prevention, but that is to change behaviours in the long term. And the individuals in healthcare, but all of those leaders that we need to convince to ensure the right climate exists to allow hand hygiene to happen at the point of care. To take a fresh look at all of the resources available as part of this project, as part of your hospital country activities. Again, to be part of this, to remain available for the work that you do, you to continue to communicate with WHO and to work with us on equals of success.
Thank you, Patrick, for the interesting and complete presentation. Have a bad news actually, as Dr. Gonchev is unable to make his presentation today. The reason is that without access to any internet connection, the building he is working from has no internet today. Sorry for the inconvenience. And Dr. Kilpatrick, we received a number of questions for you. Would it be possible for you to answer now?
Yes.
A copy of the questions in your chat box. The first one says, in your opinion, which is the hardest component of the multimodal strategy to implement? So one has more barriers.
The climate, ensuring a culture that supports all of components. Training education is accepted as, and it should exist. While every hospital in every country does dedicate resource to this, posters are available and cheap and easy to make locally, and of course are available from WHO, so there's no resource required. Plus, in most countries, an alcohol hand rub is available in most, and in 40 countries now, they are producing their own alcohol hand rub as per the WHO formulation and do expensively. So there's the system, a big part which WHO aim to do, and work that I lead on for WHO, private organisations for patient safety. For WHO, it's work through corporate social responsibility to advance the full, reliable access to hand rub in countries. So many components have been addressed. There's consistently supporting this priority to make climate is challenging. Even if leaders engaged, sometimes they leave the hospital. Other priorities are more important, and that hand hygiene is fixed, that is no longer a problem. And we change the behaviours of all healthcare workers. So deputy climate is most challenging, and as I urge people to be sure that they engage senior leaders and managers and administrators implementing hand hygiene improvements. I teach on hand hygiene often. I send to handling are the most junior staff. They think hand hygiene is simple, and there's a lot of evidence to demonstrate how applying hand hygiene at the point of care is intuitive to us. And that is part of the safety climate change. One of the first steps is actually engaging senior managers before you start to plan any more hand hygiene improvement. It's unfortunate today that our colleague cannot join us Mission does not include the many examples from many different hospitals, because we are about to hear examples from Europe. Disappointing. There are so many examples people have in hospitals, and actual web pages do not have the facility to share all those examples, while country networks do share between themselves. And I will say the Costa Rica story featured in the WHO web pages is a good example for you with others. The second question: why there is lower compliance in moment 1 after the intervention? With hand hygiene, we are dealing with invisibility. Carry on our hands. Their behaviour of our healthcare workers see these germs on their hands, who are directly touching a patient's skin, who made their hand 10 minutes ago and touched many other things, but do see that touching a patient after touching the healthcare environment will potentially cause them harm. This huge behavioural challenge. Most to be the lied with. And it shows that we focus healthcare workers on flow and how we make it easy for them to do it at that time. Of course, is critical preventing those organisms from entering the patient's body system. Your clients is low and address, including moment 1. Moment 2 is low. That, of course, has to be a starting point from patient safety harm perspective. Last is do some kind of positive reinforcement or certificate issued until meeting level of compliance would be positive. Certainly have, not just in the field of hygiene, but in the field of improvement, have actually undertaken this positive enforcement, have used punitive measures, negative back, punishment. Then say recommendation for this because on the local culture, and I test different approaches and that understanding, for example, the distance that exists in your country. By Borg from Malta on the Journal of Hospital Infection, cultures and how they affected MI reduction. Your culture will help you understand what of measures like reward, punishment, or other aspects will really improve hygiene. I must emphasise again that the components of this strategy must all work together in hand hygiene. If it's on reward or just on, we know that will not have a sustained effect. Conclude there the questions, and I hope that in the future we can continue to share examples of challenges and successes. And I urge you to continue to look at the WHO tools, take a friend of them, and my colleagues in any European countries for supporting the WHO work.
Thank you, Dr. Patrick. Thank you again, and we apologize again for the inconvenience we experienced with our second presenter from Bulgaria. I will be available soon for a specific webinar on this case study. I would also like to thank all the participants and remember that national examples of hand hygiene interventions are available on the PaSQ website, as well as a record of this webinar that will be available in the next day. out the PaSQ website and explore it. Feel welcome to get in touch with us and all the partners for questions and further assistance. And have a nice weekend. See you next.